If you've taken ibuprofen in the last 30 days, and statistically, there's a very good chance you have, I need you to watch this video before you take another pill. I'm a urologist. I see kidney failure. And I can tell you right now, some of the most devastating cases I've seen didn't happen because of some rare disease or genetic condition. They happened because someone took the same painkiller you probably have sitting in your medicine cabinet right now. Over and over. For months. Sometimes years. Because nobody told them it was dangerous. And here's the part that makes this even worse. Most of these patients had no symptoms. Zero. Their kidneys were quietly losing function while they went about their normal lives. By the time something felt wrong, they'd already lost significant kidney capacity that they will never get back. Today, I'm going to tell you exactly what this medication does inside your body, who is most at risk, because not everyone faces the same danger, and what you should be doing instead. Stay with me. This one matters. The drug I'm talking about is ibuprofen. You know it as Advil, Motrin, Nurofen. It belongs to a class of medications called NSAIDs, non-steroidal anti-inflammatory drugs. Other NSAIDs include naproxen, that's Aleve, as well as diclofenac, aspirin at higher doses, and celecoxib. Now, these drugs are not evil. I want to be clear about that. They are genuinely effective at reducing pain and inflammation. They work. And in the right context, used properly, they're fine. But here's what has happened in the modern world. We have taken a medication that was designed for short-term, occasional use, and we've turned it into a daily habit for tens of millions of people. Headache? Ibuprofen. Back pain? Ibuprofen. Arthritis? Ibuprofen every single day. Period cramps? Ibuprofen. Post-workout soreness? Ibuprofen. The average American takes over 16 billion NSAID doses per year. That's not a typo, 16 billion. And the majority of those people have no idea what's happening to their kidneys as a result. Let me explain the mechanism, because once you understand how this works, you'll never look at that little orange pill the same way again. Your kidneys are filtration organs. Every single minute, about 1.2 liters of blood flows through them. They filter out waste, regulate fluid balance, control blood pressure, and maintain the chemical environment your cells need to survive. To do this job efficiently, the kidneys need consistent blood flow, and that blood flow is partially regulated by molecules called prostaglandins. Here's where ibuprofen becomes the villain. NSAIDs work by blocking an enzyme called COX, cyclooxygenase. This is how they reduce inflammation and pain. But COX also produces prostaglandins, and in the kidneys, prostaglandins are essential for maintaining healthy blood flow, especially when your body is under any kind of stress, dehydration, physical exertion, illness, or low blood pressure. When you block prostaglandins with ibuprofen, you remove one of the kidney's primary tools for managing their own blood supply. The blood vessels in the kidneys constrict, blood flow drops, and now your kidneys are trying to do an enormous filtering job with significantly less fuel. Do this once, when you're healthy and well hydrated, your kidneys can likely compensate. They're remarkable organs. Do this repeatedly, every day, while slightly dehydrated, while having a beer or two in the evenings, while you're over 50 and your kidney reserve has naturally declined, and you have a recipe for progressive kidney damage. There are two main conditions this leads to. The first is called acute kidney injury, a sudden, rapid decline in kidney function. This can happen the very first time someone vulnerable takes ibuprofen, especially in high doses. It can be serious enough to require hospitalization. The second is called analgesic nephropathy, chronic kidney disease caused specifically by long-term painkiller use. This develops slowly, silently, and irreversibly. The kidneys scar from the inside. Their filtering capacity decreases year after year. And because the kidneys have extraordinary compensatory capacity, you won't feel it until you've lost 50, 60, sometimes 70% of function. by which point we are having very different conversations. Conversations about dialysis, about transplants. Now I want to talk specifically about who needs to be most concerned, because the risk is not equal across the population. Number 1. People over 60. Kidney function naturally declines with age. After 40, most people lose about 1% of kidney filtering capacity per year. So someone in their 60s or 70s has significantly less kidney reserve. Their kidneys have far less ability to compensate when ibuprofen cuts blood flow. Number 2. People with diabetes. Diabetes is the single leading cause of kidney disease worldwide. If you have diabetes, your kidneys are already under chronic strain. Adding ibuprofen to that equation dramatically accelerates damage. Number 3. People with high blood pressure. Hypertension damages kidney blood vessels over time. NSAIDs not only add further vascular stress, they actively counteract many blood pressure medications, making them less effective. It's a double hit. Number 4. Anyone who is dehydrated. This one catches a lot of people off guard. If you take ibuprofen after a long run, after a day in the heat, the morning after drinking alcohol, or during a bout of vomiting or diarrhea, your kidneys are already in a compensatory state. Removing prostaglandins at that moment can trigger acute kidney injury even in otherwise healthy people. Number 5. People on certain medications. ACE inhibitors, ARBs, diuretics, common blood pressure and heart medications, combined with NSAIDs, create what nephrologists call the triple whammy. The combination can precipitate acute kidney failure rapidly. If you fall into any of these categories, I am asking you directly, please have a conversation with your doctor before you continue regular NSAID use. Here is the deeply frustrating truth about kidney disease. It doesn't hurt. Not in the early stages. Not even in the middle stages for most people. Your kidneys don't have the same kind of pain nerves that your stomach does. They don't swell in a way you can feel. They just quietly do less and less work until the deficit becomes impossible to ignore. By the time symptoms appear, meaningful damage has often already occurred. But there are signals, and I want you to know them. Watch for swelling in your feet, ankles, or around your eyes. This is fluid your kidneys aren't removing properly. Fatigue that feels different, heavier than normal. Changes in urination, going more or less frequently. Urine that's foamy or bubbly, which can indicate protein leaking through. Persistent puffiness in the morning. Brain fog. Nausea without an obvious cause. And if you are someone who takes ibuprofen regularly, weekly or more, please get a simple blood test, creatinine and eGFR. These numbers tell you how well your kidneys are filtering. They are cheap, fast, and could save your life. Ask for them at your next checkup. I am not here to tell you to just suffer through pain. That's not medicine. That's cruelty. So let's talk about real alternatives. For most acute pain, headaches, muscle soreness, minor injuries, acetaminophen, known as Tylenol or paracetamol, does not affect kidney blood flow the way NSAIDs do. Used at appropriate doses, no more than 3,000 milligrams per day, and less if you drink alcohol regularly, it is significantly safer for your kidneys. Note that acetaminophen has its own risks for the liver in excess, but for kidney-specific concerns, it is a much better choice. For inflammation and joint pain, topical NSAIDs, gels and creams like diclofenac gel applied directly to the skin, deliver anti-inflammatory effects locally with far less systemic absorption. Your kidneys see only a fraction of the drug compared to oral doses. This is a genuinely underused option. Ice and heat therapy remain among the most evidence-supported treatments for musculoskeletal pain. They're not glamorous, but they work without any kidney risk whatsoever. For chronic conditions. If you have arthritis, chronic back pain, or other conditions that have you reaching for ibuprofen daily, that's a management problem that deserves a real medical conversation. physical therapy, anti-inflammatory diet changes, weight management, targeted corticosteroid injections, and newer biological medications all have roles to play. There are options. Supplements with anti-inflammatory properties. Omega-3 fatty acids, turmeric and curcumin, magnesium. These have evidence behind them for reducing chronic inflammation. They are not as fast or as powerful as ibuprofen, but for ongoing management, they support your body rather than stressing it. The key principle I want you to take away is this: ibuprofen is a tool, not a lifestyle. Short-term, occasional, at the lowest effective dose, with adequate hydration. That is how it was designed to be used. If you find yourself reaching for it multiple times per week, that's a sign your body is telling you something, and ibuprofen is muting the alarm rather than solving the problem. I had a patient, I'll call her Maria, 54 years old, active, healthy weight, no diabetes, no major medical history. She came to me because a routine blood test at her internist flagged slightly abnormal kidney numbers. When I asked about her medications, she almost didn't mention it. "I just take ibuprofen," she said, "for my knees, nothing serious." She had been taking 600 milligrams twice a day for almost 3 years, every day. Her eGFR, the measure of kidney filtering capacity, was 52. Normal for her age should have been in the mid-70s to 80s. She had lost roughly 30% of her kidney function, and she felt completely fine. We stopped the ibuprofen. We worked on alternatives. Her numbers stabilized. They didn't fully recover. Some of that damage was permanent, but we stopped the slide. Maria was lucky. She found out in time. Not everyone does. So here is what I want you to do after this video. Just 3 things. 1. Take stock of how often you're actually using ibuprofen or other NSAIDs. Be honest with yourself. If it's more than a few times a week, that's worth addressing. 2. If you're in a higher risk group, older, diabetic, hypertensive, or on blood pressure medications, talk to your doctor about your NSAID use specifically, today, not eventually. 3. Request a kidney function panel at your next appointment. Know your creatinine. Know your eGFR. These numbers take about 5 minutes to get, and they tell you something critically important about your long-term health. Your kidneys do not get second chances. Unlike your liver, which has remarkable regenerative ability, kidney function that's lost is largely gone. Prevention is the entire game here. If this video helped you, share it with someone who takes ibuprofen regularly. You might be doing them one of the most important favors of their life. I'm Dr. Lina. Subscribe for more evidence-based health content that actually matters. I'll see you in the next one.